Alright, so today we're going to talk about a positive behavior support plan. So positive behavior support plan, communication skill development. So the name of the person supported is LilliBeth. Her direct support professionals are Courtney and Anna. The implementation date of the plan is November 5th, 2018. The review date by the Ethical Review Committee is October 25th, 2019. The date the Positive Behavior Support Plan is to be reviewed are April 3rd and September 9th of 2019. Modifications required. So in order for LilliBeth to complete the social story programming, she will need a visual representation of the actual social story, as she will be required to read it back to the instructor. She will also require a visual representation of the scenarios presented to her. She will be equipped with pre-made response cards that will enable her to respond and participate within the programming. Her decision maker or substitute decision maker is her Aunt Lisa. So background overview of the person supported. So LilliBeth is a 19-year-old woman who experiences life with a developmental disability and a diagnosis of autism spectrum disorder. She is also diagnosed with hypertension and asthma. LilliBeth lives in a supported independent living program but has expressed her desire to live independently both vocally and through her behavior. LilliBeth currently holds a volunteer position at a local animal shelter but is at risk of losing that position due to her aggressive behavior. LilliBeth becomes agitated when she feels as though her voice is not being heard and her wants and needs are being ignored. These feelings cause her to act out aggressively. LilliBeth has a history of challenging behaviors that include biting herself, striking out at others, throwing objects, and yelling profanities. LilliBeth enjoys spending time with animals, recording video journaling, completing word find books, watching movies, and listening to music. So description of the challenging behavior. So the antecedent is the volunteer supervisor approached LilliBeth to discuss her inappropriate behavior exhibited in the workplace. The target behavior, so LilliBeth became aggressive, screamed profanities, threw objects, and bit her arm. The function of her behavior, so we can determine the function of her behavior as actions to avoid/escape the given situation. LilliBeth begins to act aggressively, scream profanities, throw objects, and bite her arm in response to an uncomfortable situation in which her behavior is being questioned in a place she quite enjoys. Instead of being able to effectively communicate her thoughts, feelings, and reasons with her supervisor, LilliBeth acts out and eventually storms off to escape the entire situation overall. I think it's also very important to note that there's an underlying function to LilliBeth's behavior that becomes evident upon closer inspection of her case file. LilliBeth has a history of challenging behavior in response to the fact that LilliBeth perceives that her thoughts, feelings, and choices are not taken seriously and are typically not discussed. Due to the fact that LilliBeth feels very unsupported, we can determine that the function of such challenging behavior is also attention-seeking in nature. So the consequences. So LilliBeth was asked to leave the animal shelter immediately. LilliBeth continued to yell profanities at the supervisor and pushed Anna, her direct support professional, aggressively out of the way as she was exiting the building. So there are some cautions when supporting LilliBeth. So LilliBeth exhibits many challenging behaviors that place the safety of herself and others at risk for harm. LilliBeth exhibits self-injurious behaviors in the form of biting her arm. LilliBeth demonstrates many aggressive behaviors that include throwing objects, striking out at others, screaming profanities, and pushing others. Due to the fact that this programming elicits emotional responses, instructor should be well versed in the behavioral protocols developed for LilliBeth. Extreme caution should be taken when supporting LilliBeth, especially when she is exhibiting signs of frustration and agitation, as well as when she experiences times of heightened anxiety. These emotional states will cause LilliBeth to act out aggressively and demonstrate the challenging behaviors listed here in the plan. The functional or equivalent replacement behavior. So to support LilliBeth with communication skills, the instructor will present her with a 2-part social story program in which LilliBeth will respond to given scenarios using response cards. So the teaching strategy and methodology of the plan. So LilliBeth will be presented with 2 social stories that will aid her with the challenging behaviors that she exhibits. These social stories will encompass strategies she can use to control her aggressive behaviors and help her to manage her emotions. Thus, the social stories will target the functions of her challenging behaviors, specifically her inability to communicate her thoughts and emotions. Developing these strategies will allow her to feel as though her voice is being heard, which will in turn decrease the likelihood of her challenging behaviors. So the actual procedure. This is just a brief overview. You're going to see the entire program presented to you in a YouTube video later. So the instructor will read aloud the social story to LilliBeth in a positive manner. Instructor will encourage LilliBeth to read the social story back to the instructor with assistance when required. The repetition will help to ensure that LilliBeth gains retention of the skill. Instructor and LilliBeth will discuss important takeaway information. This will also help to ensure retention of the skill is developed. Instructor will present LilliBeth with 2 scenarios in which she has to apply the skill. She will be given 2 response cards to assist her with responding and participation. This will help to ensure that she can generalize the skill across stimuli, people, and settings. The instructor will record her correct and incorrect responses on a designated form for data collection. This will help ensure that the program remains effective and relevant to LilliBeth. Once mastery has been achieved, LilliBeth will repeat the program, but for the second half of the skill. The process will remain the same and will continue until mastery is achieved. So training requirements. All staff must successfully complete all components of a refresher training course, including both theoretical and practical material. The recertification schedule is developed by the service agency and must be completed before assisting individuals supported. All staff members, including volunteers who work directly with LilliBeth, must be trained on the interventions used in this PBS plan before supporting her as for the policy directives outlined by the quality assurance measure standards. What should direct support professionals know before supporting LilliBeth? LilliBeth often becomes very anxious. LilliBeth has used breathing exercises and was given PRN medication for anxiety in the past, but it has been unsuccessful. LilliBeth refuses to take this medication. LilliBeth's diagnosis of hypertension and asthma, coupled with her anxiety, affects her ability to communicate effectively. When she is feeling anxious, she has a difficult time breathing, which also causes her to have difficulty retrieving words and articulating clearly. All right, so now it's time for the demonstration, and here you'll find a YouTube link so that you can actually watch the entire social skill program.